As a cardiac nurse, I have the privilege and responsibility of caring for my patients during some of the most vulnerable and life-altering moments of their lives. Through my experiences in cardiac care, I have developed my personal nursing philosophy grounded in compassion, vigilance, and personal growth. Today, I will share my three principles that guide my daily practice and shape my professional identity. Cardiac nursing requires both strong clinical expertise and genuine compassion. Patients are often admitted after sudden events such as heart attacks, arrhythmias, or heart failure exacerbations. These events not only impact their physical health but also can create fear, uncertainty, and emotional distress. Working in this environment has shaped my philosophy. I have learned that excellence in cardiac nursing requires more than monitoring telemetry and administering medications. It requires intentional communication, proactive advocacy, and a commitment to lifelong learning. My first guiding principle is patient-centered cardiac care. Cardiac events are often unexpected and overwhelming. Most patients express fear about their future, their medications, and the lifestyle changes they will now face. Through experience, I have come to understand that education and reassurance significantly influences recovery. When I take the time to explain a new diagnosis, review medication purposes, or clarify discharge instructions, or patient handouts on health for heart care, I see patients become more confident and engaged in their care. This principle developed as I observed how empowered patients demonstrate better adherence and improved outcomes. By focusing on the individual, not just their cardiac condition, I promote both physical and emotional healing. My second principle is clinical vigilance and advocacy. In cardiac nursing, small changes can be a signal for significant deterioration. A slight rhythm variation, new shortness of breath, or subtle blood pressure trend may require immediate action. I have learned that being vigilant is not optional, it's necessary. Advocacy means trusting my assessment skills, communicating my concerns clearly, and intervening promptly when necessary. There have been moments when early recognition of a change led to rapid intervention and prevented further complications. These experiences reinforce my belief that nurses are often the first line of defense in patient safety. Advocacy reflects both ethical responsibility and professional integrity. My third principle is lifelong learning and professional growth. Cardiac care is continuously evolving with new medications, updated heart failure protocols, and the ever-changing evidence-based practices. Early in my career, I realized how quickly healthcare advances. I realized that maintaining competency requires intentional effort, reviewing updated guidelines, and participating in continuing education and reflecting on complex patient cases. This commitment to growth ensures that I provide safe, evidence-based care. It also strengthens my confidence as a cardiac nurse and supports the high standard of my care my patients deserve. In conclusion, my nursing philosophy is shaped by the realities of cardiac care, a specialty that demands precision, empathy, and accountability. Through patient centered care, proactive advocacy, and lifelong learning, I strive to provide safe and compassionate care during some of my patients' most vulnerable moments. These principles guide my decisions, strengthen my clinical judgment, and define the nurse that I continue to grow into each day.